My name's Katie Brumfield. I am the Career Services Specialist at the Colorado School of Public Health, and today we are going to talk to Molly Moss. She is an alum of our school from 2019. Her concentration was community and behavioral health, and today Molly is going to tell us about her career. Molly, if you wouldn't mind starting with telling us your current work title and where you work.
Sure. Hi, everyone. Hi, Katie. Good to be with you all today. I am now at the United Nations Foundation, and my title is Global Health Policy Associate.
And could you just describe either a typical day or kind of larger projects you might be working on?
Sure, yeah, I'll describe a little bit about the couple areas of work that I'm responsible for. First, and maybe most interesting, is that I'm the focal point for the UN Foundation's relationship with the World Health Organization. So WHO is, of course, a UN agency for health. And as the foundation, our role is to kind of advocate for WHO and enable them to do their work by both advocating on Capitol Hill for US support to WHO and among other constituents and other audiences. So in doing that work, we track a lot of what WHO is doing. I may join a press conference or a meeting, kind of listening to what countries and member states are saying about WHO, their challenges with, say, COVID-19, listening for trends so that we can be effective in supporting WHO, supporting countries. Another really interesting dimension of this is, as I said, advocating for WHO on Capitol Hill. And we have a whole team of colleagues at the foundation that do this work directly. And as someone with a little more health expertise, I kind of feed our advocacy colleagues information about how WHO is responding to, say, COVID-19. For example, they set up an independent panel to review the work that they've done in response to COVID-19. And we want to make sure that the administration and members of Congress are aware of this work. And so it's really kind of doing a lot of behind the scenes communications to shore up support for the World Health Organization. And then the other audience that we face, and this is a new area of work for me, is the UN diplomatic community in New York. So traditionally, a lot of the health work has come out of Geneva, where the WHO is located. But the New York audience is really powerful, and they're becoming increasingly interested in health issues. And so we want to bring them information, whether that's setting up mission briefings so we can talk to them about equitable distribution of COVID-19 vaccines or about antimicrobial resistance, really just opening up the channels for them to ask questions and connect with technical experts on these health issues. So that's not so much tactically what I do from day to day, but kind of an overview of the responsibilities of my job description, and I'm happy to elaborate if you'd like.
What an exciting time to be doing this position. How long have you been in this role?
So I actually started at the foundation a year ago today.
Happy anniversary.
Thank you so much. And I started in a different role. I was coordinator for the global health team and also the girls and women's team that tackle gender equality issues in the UN environment as well. I transitioned into the policy associate role back in June, and it's a great fit for me. And it ties into a little bit of kind of my advice that I think we'll get to later on.
Wow. Well, that's so cool. Could you explain a little bit of your career background? Like, what did you do for jobs before this?
Yeah, sure. And I'll include some of my educational background too, because I think it's relevant. When I was in high school, I was really interested in kind of complementary and alternative medicine. And as an undergrad, I started exploring those topics and ended up doing a major in medical anthropology. And anthropology is fascinating. I think it ties in really nicely with community and behavioral health, which was my focus as an MPH. But really, it's kind of getting at the concept that people and cultures have different ideas about health and illness, and getting sick and getting well. And while Western allopathic medicine is a really powerful body of science, if it's not understood and embraced by other communities, it's kind of pointless, right? So if we want to share that technology and that science, we need to connect meaningfully with these other cultures and communities. So that's kind of where my interest came from. When you have a bachelor's degree in anthropology, there isn't much that you can do with that. And it took me a little while to realize that public health is kind of the practical, operational side of that work. So I started actually as a volunteer at the Center for Global Health at the Colorado School of Public Health, and that turned into an administrative assistant position. I organized our lecture series, our Global Health and Disasters course. I spent 7 years actually at the Center for Global Health, and it was a wonderful experience, connecting with faculty, of course, with students, and really just being exposed to a lot of health topics and issues that maybe I wasn't necessarily interested in on my own, but became interested in by virtue of that exposure. I did go through a few positions at the Center for Global Health and finished up there as a program coordinator, so some increasing responsibility, before doing my MPH and then moving over to the UN Foundation.
Great. So did you work full-time while you were getting your MPH?
I did.
And how long did it take you to complete your MPH?
3 years.
3 years, yeah. That's about, I think, with people working full-time, that's what I hear.
Yeah, I don't think I could have done much, I don't think I could have done it much faster and maintained my sanity. But I think it was really amazing to be able to kind of map work experiences to the classroom and vice versa, bring classroom knowledge into work and really see those connections and create those connections in my mind.
Yeah, no, that's great. Okay, how do you feel the Colorado School of Public Health prepared you for your current career?
Yeah, sure. I think what most benefited me through my MPH training was gathering the tools to think critically about health issues from different perspectives. So part of that is developing an understanding of the common language of public health through epidemiology and biostatistics, so that when I read information, whether it's a study or a news article, I can interpret what is meaningful and what is kind of reliable, and then critically think about and share that information. It was really kind of an enabling environment to, again, develop the vernacular to communicate in a common language with other health professionals and even outside of the health realm. At the foundation, I work on policy issues and kind of global governance, but when I was with the University of Colorado and the School of Public Health, I was on the total opposite end of that public health spectrum, right? So academia and research is kind of the discovery of new knowledge and this really granular type of information. And then you have kind of the middle part of that spectrum, which is program implementation and monitoring and evaluation, which I haven't really worked in that area. And now I'm at the other end of the spectrum, where that all of this work that happens elsewhere becomes policy and governance. So I think really understanding the whole public health environment was a really key takeaway from my training. And it like, the fog kind of cleared in a lot of ways. Of course, there are lots of technical skills, but when I like reflect on it, that was one of the big takeaways, is really the ecosystem of public health actors and actions that we're all kind of taking on separately to then collectively create better outcomes.
I love the way you say that, the ecosystem, because it really is. We need all of you in public health. But then how do we all work together and impact?
And I that's part of what's really exciting to me about public health, is that it takes lots of different types of minds and skills to solve these complex problems. Mm-hmm. Doctors are not going to really help create sewage infrastructure that we need for water and sanitation, right? Like we need engineers for that. And engineers are not going to be able to allocate a certain part of the national budget to health issues, right? Like we need politicians for that. And so I think the COVID-19 crisis has definitely brought into focus how public health is intersecting with all of our lives, whether you operate a bus or you run an NGO, right? They're all players in this field, whether they have a true awareness of it or not. And I think someone with an MPH training is in a really unique position to be the hub of all those spokes.
Yeah, I totally agree. What advice would you give to someone that is looking to pursue a career in public health?
Yeah, I think I have both advice for kind of the MPH training and then how that might be parlayed into a career. So thinking about the MPH training, I think it's really important to maximize the practice-based learning requirements. So my practicum and Capstone were both really amazing experiences that I treated almost as like working interviews. And I would encourage students to really think of those requirements as opportunities to connect with an organization or an initiative that you are actually passionate about and not just check the box of having completed practicum or Capstone. How that translates into kind of then the work environment is that it sounds super cliche, but you're making connections and you're networking and you're both realizing what you do want to do and where you might want to fall on that spectrum that I was talking about, and also where you don't, right? Like academic research is not for everyone, but it is right for some people. So kind of narrowing down where you see yourself fitting into that puzzle is something that takes kind of active effort and maybe a little bit of trial and error. So by actually using your time in the field as a student, you're making steps towards where you want to be as a professional.
Can I ask, what did you do for your practicum and Capstone, or where did you do it?
Yeah, sure. So I worked with a physician who's affiliated with the Center for Global Health. He was invited by the Measles and Rubella Initiative to do a rapid assessment of the measles program in Thailand. And we went to Thailand and had a series of presentations in the capital in Bangkok from national health authorities. And he, as an expert in this field, he's again a physician and I am not, was able to really critically kind of assess where the program was strong and where there were opportunities to strengthen and grow. We also did a field visit in a more rural area of Thailand where he, again, was learning from these health workers the way that they identified measles cases, which they had never seen before, and actually like push it up through the system to recognize that there was an issue going on. So that was really amazing. In that capacity, I served sort of as a rapporteur, and I drafted the first report that went back to the Measles Rubella Initiative. And yeah, it was a heavy lift. It was a really intense and immersive experience, and one that I'm really grateful for because, as I said, I haven't spent a lot of time in that middle part of what I think of as the public health spectrum of really understanding kind of at the country level how program planning, implementation, and monitoring and evaluation are actually happening or not.
Yeah.
For my capstone, I worked with another pediatrician who is based at Children's, also affiliated with the Center for Global Health. Her name is Dr. Susan Niermeyer. She is the pioneer of a program called Helping Babies Breathe, which is a neonatal resuscitation curriculum that is meant to be delivered in low and middle income settings to help healthcare workers identify newborn babies who are not breathing, but are very much alive and well and have cardiac activity. There's a really critical window of time where essentially healthcare workers need to perform CPR. And it's a really scary thing to do with a tiny baby, and the steps aren't always clear. So her training aims to really empower healthcare workers to know what to do and to take rapid action. And her program has been scaled up all over the world. It's been rolled out in 80 countries. It's been translated into 25 or 26 languages. So
that's
the
amazing.
WHO, yeah, it's incredible work.
Yeah.
And the WHO thought it was incredible work too, and wanted to kind of integrate it into their neonatal care program. And so for my capstone, I supported the effort to kind of integrate helping babies breathe with the broader WHO framework. And so we went through a process of field testing the curriculum in Dar es Salaam, Tanzania. And so we worked with hospital workers there on what was kind of a harmonized curriculum between the original Helping Babies Breathe curriculum and the WHO program. So it was therefore a new training package, and it needed to be tested and kind of iterated at the country level. That was a long-winded answer, but
no, it was a great answer.
Different, really exciting projects. And I think, again, I was working with two physicians who are very much experts in their fields of immunization and neonatology. And as a public health practitioner, my role in that was really different than theirs. And I think the public health degree is one of like kind of connecting the dots and bringing the pieces together, bringing people who have maybe deeper expertise in one area together with folks that can like operationalize that in other ways.
Yeah. And I see how now you're continuing to utilize that skill.
Yes. Thank you.
All right. One last question. United Nations Foundation. I mean, so many people I'm sure would love to work there, and I'm sure the application process is super competitive. What advice would you give if someone's dream job would be at the United Nations Foundation?
That's a good question. I think for any job application, there needs to be this kind of sincerity that comes through in your cover letter, right? Like you can gussy up your resume or you know, do all those things that we think of when we apply for a job. But I think really connecting with the mission of an organization and having that be evident in your application is important. And it is part of the screening process. When we recruited the person to replace me as coordinator, we had tremendous interest, but we had a really thorough, review process. I don't think anyone slipped through that wasn't a really good qualified person. Of course, having connections, existing connections, and I don't mean high-level connections, but any kind of relationship with the organization that you're looking for is really helpful, because if you've been an intern or you've had an informational interview, you can go back to that person and say, hey, I know you're not in this department, but I wanted to let you know I'm applying. And it, unless you're not in their good graces, they'll pass that name along, and it helps surface you as a candidate. But I do believe that really allowing something of your personal qualities and characteristics to shine through is what sets applicants apart from the rest of the pack.
Great advice. I love that. All right. Well, thank you so much for taking the time to speak with us today. I know you're super busy, and we really appreciate it. You gave lots of really great advice. And thank you for all the hard work you're doing for the public.
You bet. I'm happy to connect with you and look forward to the next time we connect.
Yeah, and it's good to see you.
Yeah, of course.
All right.
Thank you.